Okay, we're live. So, hello YouTube. I hope I'm not saying hello to 0 people. That's never usually happened. We're live. So, hello YouTube. I hope I'm not saying hello to 0 people. That's never usually happened. We're live. So, I think there might be a slight lag on here. Yeah. Hopefully that goes as we carry on. But hi for those of you watching. We're here with Rubina, Dani, Shanta, Kanukolu. I hope I said your name correctly. And Tina Mystery. Hello, Ghazal. We're here to talk about intergenerational trauma today in the South Asian community because it's a topic that doesn't really get spoken about enough, and we really want to shed a light on it, inform everyone watching, and hopefully have some very interesting discussions. And if you don't already know us, we're the Brand Therapist Network. We're a network of South Asian therapists that are all trying to grow, develop, connect, make the world a better place, for lack of sounding cheesy. And yeah, we'll just get into it. I'm just going to share my screen. This usually takes a minute to work properly, so just bear with us. Okay, can everyone see my screen?
Mm-hmm.
Okay, and you can hear me? Sorry, I can't see you.
Yes, I can hear you.
Brilliant, thanks. Okay, so what does intergenerational trauma look like in the South Asian community? As I just mentioned, we're the Brand Therapist Network, and we really want to inspire learning and growth in our therapists, and we want to disrupt Eurocentrism and shed a light on South Asian mental health. So the lovely people that will be talking to you today include Tina Mystery. She's founded this network. She's also founded another project called Another Mother Story. She's a consulting psychologist and a strong advocate for South Asian mental health. She's delivered talks on race, ethnicity, trauma, and I personally have also learned a lot from her myself. We've got Shanta Kanukulu, who's founded SNK Therapy, and she works clinically with clients of diverse backgrounds in forensic and medical settings. And she's also taught university courses on diversity and gender. She provides education and outreach regarding mental health outcomes in ethnic minority communities. And last but not least, we've got Rubina Thani, who owns Mind Peace Wellness, where she works as a licensed marriage and family therapist and empowerment wellness coach. She's certified in EMDR and Reiki. And she also supports women in a holistic healing journey to find their authentic selves. Sorry, the last bit was hidden from me. So if you're here and you're watching, you're probably wondering what intergenerational trauma is. So intergenerational trauma is the phenomenon which describes trauma that has occurred in a previous generation, and that affects the subsequent generation of a family in various ways. So the trauma effects might be visible in the subsequent generation, or even in several generations after. So even if trauma impacted your grandparents in some way, it could still impact you. Sometimes when people use the phrase intergenerational trauma, it it can mean, we might mean to refer to historical trauma, and this is one type of intergenerational trauma. There are other examples, and they can include domestic violence, witnessing microaggressions, migrant trauma, witnessing explicit racism, and patriarchal trauma. So what exactly is historical trauma? So this is a type of intergenerational trauma that's experienced by a specific cultural group that's got a history of being systematically oppressed. Whilst intergenerational trauma focuses on a specific family line, historical trauma focuses more on a collective group that have suffered. And this is a pretty interesting quote by Alexander. So when members of a collective feel they have been subjected to a horrendous event that leaves indelible marks upon their group consciousness, marking their memories forever and changing their future identity in fundamental and irrevocable ways. So is there much research on how this actually impacts us? There isn't so much research, which may not surprise many of you watching. So there is research on intergenerational trauma itself, but not necessarily in our particular communities. And this is another quote that you might find interesting. One could assume that the psychological trauma of non-Europeans was not likely to be of sufficient academic concern in the West. And here are a few reasons why this might be the case. If you can think of any other reasons aside from the ones on the screen, feel free to comment and let us know. So what are some examples of historical trauma in the South Asian population? Again, if you're watching can think of any, please just let us know using the YouTube chat function. You can let us know in the comments, and I'll just put up a few on the screen here. There's the Indian indenture system, 1984, Sikh genocide, partition of India, of course, the Bangladesh War of Independence, the expulsion of South Asians in East Africa, the Rohingya crisis, and the Sri Lankan Civil War. So how can historical trauma present? So it can present in many ways. The people that you see on the panel right now, they have far more answers than I do. And this is a resource that we've created on Brand Therapist Network, just to highlight it a little bit. If you're interested in learning more from this PDF resource, then you can create an account. You're welcome to on our website, and you'll have access to it. And of course that last slide was obviously a lot to look at, and some of you might have some questions that you're thinking of now, and you're welcome to direct any questions to our panel. So yeah, just let us know what you would like to know. And whilst you might be thinking of what to ask, we'll start off with a question of our own. So to anyone that would like to answer, how can intergenerational trauma present in a clinical context?
Awkward silence, right? Don't you just hate them? Let's just pitch in. I guess, I'm curious to hear from Shanta as a fellow psychologist, kind of what you see, and then I'd like to kind of know from Rubina what you see as well. From my experience, you can't really say, oh, right, when somebody presents, that's intergenerational trauma. Part of the assessment phase, when I kind of go through my assessment phase, is usually around history taking. And when we start to unravel what that person's history has been like, so they start to share what their childhood was like, often people would stop just there, but actually I like to go a bit deeper. I kind of say, right, tell me more. where did your parents kind of migrate from? What about your grandparents? Tell me your stories that you remember being told about your family members. So it's really about trying to build this really broad picture. And one of my favorite things to use and create as a tool, and kind of Rubina will be able to tell us more, is around the family tree. I love family tree. Just drawing out those particular, circles and squares, and kind of really marking out. It looks like a mess often, but when you're marking out the sort of patterns that might be presenting within relationships, across relationships, and also you're able to kind of visually illustrate to people what may have been transmitted down. And sometimes it's not clear. Sometimes it's really, really obvious, the kind of patterns that emerge from one parent to another and so forth. So for me, I think it's not an obvious thing, but what you start to see are patterns. Patterns emerge around psychological disturbance, or attachment issues is often something that we would talk about, where you might have a disrupted attachment for whatever reason. So it's really important to spend time observing, and then to start to help with the explanation around how that could have occurred. But yeah, I'm really interested to know what my other panelists, my colleagues, do as well.
I can jump in. I think I do something very similar to what Tina said about really exploring my clients' histories to see what contributed to their presenting issues. It's not just about what's happening to them in that moment, but about what was their ancestors' experiences like that led them to this country, to my office, right? And then to want to explore more about how that led to their current presentation. Something I found too is in that conversation, there is a lot of unknowns that come up. A lot of my clients will say that they're not sure about what their grandparents were like as parents, or they're actually not sure where their grandfather was born. And so how can intergenerational trauma present in a clinical context? I think in those silences and that absence of information, I think that's a big way I've seen it play out. That I work with adults, and the adult children that I work with, these adults, don't know so much of their history, not because they don't care to, but because their families have perhaps felt like they need to be silent, or need to protect their children from some painful histories, or maybe don't want to talk about it, or don't know how to process it with their families. And so there's some gaps in the history. That's on the other side of it. There are some people, like you were saying, Tina, who you can see it all over their family tree. It's very alive how their families have experienced trauma. The other side of it is that absence, right? And that silence, and that big question mark about who are my parents? Because I actually don't know much about them. They've learned to deny or minimize as a way of self-preservation.
That's really interesting, and it must bring up a lot for them if they kind of have that realization, like with you in therapy, that they don't know much about their parents or grandparents.
Absolutely.
And I'm just going to piggyback off of that, because that is something similar that actually, I resonate with both of my panelists here, that I do, depending on how much information they do know about their family. And a lot of them, like, they don't, and that's intergenerational trauma mask right there, where it's like, don't go into the past. We don't know. We don't want you to know. because it's too hard for them to maybe come up with it or to process it. And so with that, I just try to tell my clients at that moment, like if they want to do like, one of those things where you can get your genes and like your family tree from one of those services or something like that. It's something for them to go and explore, and I hold space for that for them, because that could take so many sessions, so many years, and all of that. And I think including that with our intake process, that I do, it helps them to really start to think about, okay, what are the repeating cycles that I'm even seeing right now? What did I see when I was a child? So I kind of I route them towards like, okay, what do you see now if we can't go down your family and we don't know what your family did, and so in that way, I see a lot of clients do pick up the pieces and start putting them together with me in session. And I find that a lot more also therapeutic, because so much of us do not know our family history. We only see what we read or what we kind of know. So I definitely think that bridging that gap will help in those ways too.
It almost sounds like there's so much detective work almost that happens in these sessions, because you're really like helping them piece things together that could have happened decades ago.
Yeah, and even if they do know this information, connecting those dots then, and it can also create, at times, I often tell people, therapy, one of the hazards, while there's so much growth, one of the hazards can be that it might change relationships. It might create tough conversations. It might awaken a lot of feelings, not just in you, but in the people that you love and care about. Because as these realizations and as this detective work happens in the session between me and the client, what happens is they could go and then ask their parents, ask their folks, talk to their siblings about, did you know this, or did you realize this? And that can then create a ripple effect, which can be rewarding but challenging at times too for people, based on where their family members are at with it and how much they want to do this exploration and detective work.
So you could almost be helping like the whole family in a sense.
Can be helping, can also be shaking up some
all that.
Yeah. The hope is, right, that it's helping.
Yeah.
But sometimes it can feel worse before it gets better.
That's true.
It definitely shakes up the system for sure.
Yeah.
Mm-hmm.
We've had a few comments from someone watching, from Brother Hassan. So he has a client who's developed schizophrenia as a result of being abused by a organization he was volunteering for. And when he probed deeper into the family history, he found out the client's father lost his grandfather after he saved him and his brother by placing him on his back throughout a flood that took place.
Mm.
Yeah, it's quite sad.
Yeah, it sounds like that detective work, right? It wasn't just about the organization and the abuse there. It sounds like there needed to be further exploration to find out what else was contributing to that presenting problem.
Yeah, exactly.
Mm-hmm.
And how much of those effects actually keep continuing with this one client who has developed schizophrenia.
Yeah.
Schizophrenia is a hard one.
It is a difficult one, isn't it? Because I think that, when we immediately think about schizophrenia, we think of, very distressed, severe end of the spectrum. And often we will make the assumption that it is a kind of chemical, biochemical issue. But what we don't fully understand is what actually causes the kind of fragility around the brain chemicals or the neurotransmitters or whatever it is. I'm not a neuroscientist or a neuropsychologist to use the perfect terms, but I think this is something that actually really fascinates me, in that if anybody follows or listens to Resmaa Menakem's work, who who I am deeply inspired by, who had written the book My Grandmother's Hands, he talks about how actually, within certain populations who have experienced so much oppression and trauma and what have you, we're seeing these high numbers of particularly men who are experiencing these clinically, disturbing diagnoses, who are kind of being officially diagnosed with, schizophrenia and so forth. And when we look at the data, we can actually see that there is a high proportion of Black and Asian, and this I speak for the UK because this is something that I'm aware of. There is a high proportion of Black and Asian men in kind of these clinical services, and I can't help but wonder why that is. Why is it that there is this kind of huge proportion of men who are suffering? Essentially that's kind of what's happening. And we could spend a whole other panel discussion kind of trying to explore that. But I think that there is something here that we probably do need to address, which is around how do the symptoms, how are they expressed? How is the trauma expressed within these communities? And, we talk about psychosis and kind of hearing voices. And actually now what we're talking about now in the year 2000s is actually how hearing voices is a very normal part of many people's lives, and actually culturally it is widely accepted as a kind of way of connecting to yourself and connecting to the spiritual world, or whatever it is that people make sense of it. So I think there's lots of questions that need to be asked, and we need to be doing more research and more kind of community-led intervention and understanding, really, to see how intergenerational trauma and schizophrenia, which is a really problematic, debilitating diagnosis for anybody to have. We need to start to treat these people with the love and the care they truly do deserve, because they are traumatized in many ways and continue to be traumatized post-diagnosis by the systems that are supposedly treating them.
And I wanted just to say something, just piggyback off of what I see here. I'm in California. I was at a psychiatry place, and a lot of the, brown and Black men population were coming in. And I did see that, where a lot of them just got thrown under. And, when I stepped in, I really was advocating for them, because a lot of what I saw, especially, I'm just thinking of this really one particular client who had paranoia, schizophrenia, and, South Asian, and the father is a doctor, the mother is a doctor, South Asian family coming in, and the father could not accept his diagnosis still can't. And just wanted him to be a doctor and just push him there. And so I see that a lot of, what you're saying about, like, how does this come about? I mean, so many of the men are traumatized because they're not given that opportunity either to heal and to process and to, like, be acknowledged for what they have. I mean, I felt so bad for my client, because he's just sitting there in terror, like, how am I supposed to do all this? And my dad's pressuring me when I have this diagnosis. And I'm like, yeah, no, I totally understand. Like, we need to talk to your dad about this, And it was just really heartbreaking for me to see how, authoritative the dad was. And this is, of course, an older generation coming in, who doesn't believe in so much mental health still, right? And to me, I'm thinking, like, well, you're a doctor, you should know about mental health. But I think it's just, for men, it's just really under the radar. And I think a lot more men need to speak up about getting, treatment and healing, and actually doing the work and not being shamed for it. I mean, that's also a cultural piece, right? Not getting shamed for mental health. That I just find, I think, where a lot of them are afraid to get that help because of this shame. At least that's what I have found in my practice, in my trainings. With this. And that's intergenerational trauma right there, presenting itself right in front of all of us, where it's like the dad saying, no, I don't believe in this diagnosis, and saying he needs to go to school and med school. And then the other one, and the son's like, what? No, like, am I supposed to do this?
Right.
Yeah, it would really go a long way if more therapists would like take the time like you guys do to kind of understand the family dynamics, the family histories, the ancestries, and so forth, because it can really explain a lot.
Mm-hmm.
I'm just going to go to the next question, and you all kind of touched on this earlier when you were discussing family trees. But what other therapeutic approaches work with a client presenting with intergenerational trauma?
I'll totally jump into this one because I just want to promote EMDR. Honestly, EMDR has really changed. Even for me, it's actually what started me to get into my healing in intergenerational trauma. I'm certified in it, and that's what I do in a lot of my programs to help women, South Asian, the BIPOC community to break out of these cycles, or at least to become aware of them. And I think it's helped so much because EMDR is a very impactful, high intensity healing modality, but it gets you there if it does work for you. Of course, assess you, right? But I have found that one particular is not the only one, of course, but it's definitely a good start or a way to kind of get you aware of your cycles and to go deeper and deeper into your body and your subconscious to really figure out where it all rooted from. So I just have found a lot of success with EMDR, breath work, and of course, like CBT and trauma-informed practices with that.
I've heard phenomenal things about EMDR as well and have been so curious and fascinated about it for years. So I'm so glad to hear there is a South Asian practitioner doing it. That's wonderful.
Yeah, I think I'm the only one, but
yeah, I was going to say, I don't know many. That's wonderful.
You're pioneering.
Yeah.
Doing it for my people.
I think you, oh, go ahead.
Yeah, I was just going to ask if you had anything to add.
Yeah, I think there are many avenues to treat trauma, right? I think there's so many ways to get there. I will say that I think just on a high level, individual therapy in general is a great way to start. And then family therapy or couples therapy is a great way to shift a cycle, because the way that we are parenting, partnering, carrying ourselves day to day today, if we can break a cycle with our own families, our own workplaces, our own siblings, right? Or if we could bring the previous generation into the mix, how lovely as well. So individual therapy and family therapy, I think, would be ideal. They could be done simultaneously. I practice from more of a psychodynamic framework. So my work is a bit slower, more long-term, but I find it to be really beneficial from like on both sides of the chair, so to speak. I'm as a therapist, as a psychologist, as well as a patient who has experienced psychodynamic modality for years, therapy for years. But I think, like Rubina said, there's also CBT models, cognitive behavioral therapy models specific to trauma. Another one that I've been really fascinated by and wanting to explore more is sensory motor psychotherapy, which involves the body, which, as we know, right, there's a famous book, The Body Keeps Score. And so sensory motor therapy uses both, right? Talk therapy as well as understanding how the body holds trauma. So when people are looking for therapists, I think oftentimes they don't know what to ask the therapist when working through trauma. But if there could be some conversation or some dialogue about what type of therapy is being used in the room, that can be really helpful, because sometimes people will say, like, I don't know what this person was doing. They were doing some weird thing and sending me homework, and I felt like shamed by it. And so for anyone out there who's wanting to address intergenerational trauma through therapy, I think having this conversation about what is being used in the room could be really helpful. Is it EMDR? Is it sensory motor? Is it psychodynamic? Is it CBT? And if you don't know what that is, totally okay to ask or research that to see what might be the best fit for you.
Yeah, absolutely great responses. And I think I'm going to go a bit broader from my perspective. I think there's something that we probably haven't addressed enough about, which is collective healing spaces. You know, that for me, when I start to see how people come together, communities come together and they do something, right? It could be that they, I don't know, hold a vigil for something, or they do something that is, you know, rooted in their ancestry or their religion or spirituality. There's something about that is healing. And, you know, we probably didn't touch on it in the slides, but, you know, what we're experiencing right now during COVID, saying that word, sorry for everyone if you've just forgotten temporarily, we're experiencing collective trauma, right? Probably been kind of banded around a lot. And I think that, you know, when we come together with groups or in circles or spaces where we are together and we're sharing our stories and using storytelling as a method of healing, I think that's really powerful. There's a famous quote that shame dies in places where stories are told, or something like that. And that, for me, was the point where I thought, oh, of course it does. You know, and we've been doing this for years, you know, like absolute years. Mothers come together and they, you know, sit together and they might particular stories around or about, you know, ancestors or whatever. But there's something really powerful in that. And you know, there's great therapeutic approaches, but actually there's also the sort of missed approaches that we probably don't talk enough about: peer support, collective conversations like this. Okay, they're not necessarily therapeutic in their kind of intervention, but I think they are great add-ons or great kind of experiences that you as a person can engage in. You know, with the rise of social media and the conversations we're having on social media, you know, people doing posts and people are like, oh my gosh, this is such an amazing thing. And you get chatting to people, and then before you know it, you kind of convene in a Facebook chat or on a Zoom meeting, and something magic happens. And there's something powerful in that. Let's not forget the power of being.
Yeah.
I think that, you know, polyvagal theory and all of that is exactly what is happening. It's that kind of co-regulation, you know, that kind of being together. And yeah, so there's a lot there as well that we probably often forget about.
Yeah.
I love that you said that, because I was going to say, yes, you're totally right. It is the collective healing that also helps. And I know that a lot of people just off of just our talks or what we talk about or post on, I know it resonates a lot, because I definitely get a lot of messages and DMs of like, oh my God, I had a very similar experience, or I didn't know this was also in our community and all of that. And I think it's making people aware, which is really good.
I like that quote a lot. I like that quote.
Yeah.
Thank you for sharing that.
Yeah, thank you.
Yeah, it's a great thing to remember, because that's pretty much where it all starts from, isn't it? Just someone sharing their story. And yeah, we need to remember that.
Yeah.
We've had a few questions come in, which are quite interesting. So Teggy Thomas, he mentions that Paul Rothman, Dean of Johns Hopkins University of Medicine and CEO of Johns Hopkins Medicine, has said, our scientists have shown that psychedelics have real potential as medicine. And he wanted to know if any of you have knowledge about psychedelics as part of therapy.
I can speak about that, actually. I'm actually getting trained in that right now. And actually, end of February, I'm going to get trained to actually assist therapeutic clients in psychedelic journeys because it has so much healing potential.
Yeah.
I have definitely been on the other side of that. I have a lot of clients and colleagues who've also, got treated that way. And I see so much healing with psychedelics because it does create new neurotransmitters in your brain. And I've seen it help with alcoholism, depression, anxiety, like even schizophrenia, bipolar. Like there's a lot of different types of course, go to a person who's guided and knows what they're doing. I wouldn't do this just out there on your own. But definitely, I know this is the way a lot of medicine is going towards. And I don't know if you guys remember, but I remember in grad school, they would tell me about back in the 60s that they would use psychedelics and MDM and ketamine just to help couples and all of that. So the fact that it's back here in California, we can use it now. The law got passed here in California for us as psychologists and therapists to use it. So I definitely think it's a really good way to explore because it does make new transmitters and gives you so many long-lasting impacts and improvements because of that. And I know a lot of people like Johns Hopkins, they're definitely promoting all that. And there's a lot of therapists and people who are just doing these journeys. And I think it's really going to be valuable for a lot of people who are intentional about it. Don't go there just because you want to do it and, do some drugs or something, but definitely go intentional with it and with a guide who really knows what they're doing. Because I've had those questions asked to me before. But I definitely think like this really helps a lot of people to unpack some things and also connect to them in the spirit world, where they can get some answers too. So those are just kind of my 2 cents about it. And whoever Thomas, I say go ahead and explore that. Assist your clients with that. I think it'll be really great.
I think the key is making sure it's somebody who is trained in that and not going willy-nilly on it. Just from hearing stories from people, you hear about some really problematic folks out there that sometimes promote certain things without that training. So it's so key to get that training and build that trust with the provider so that wherever the journey takes you, there's this foundation of trust and that there is an understanding of what you're going through and what will the path look like. I think is really important to know, especially when you have histories of trauma. To not know what's ahead and to not know what your body will experience can be re-traumatizing. And then I find people then don't go back to therapy because they say that was terrible. I just got re-traumatized. I'm never doing therapy. It doesn't work. But I would argue that that's usually because maybe the space wasn't built, the strength wasn't there between the clinician and the client to really talk through what happens if you feel worse. How do we come back together and ground ourselves before we continue on talking about the details or going through this journey together?
Yeah, as you were talking, it was making me think about sort of ancient uses or kind of like, things we've heard of how our ancestors may have used psychedelics in the past. And I know that within the Hindu kind of religion, we talk about Shankar Bhagwan, who is Lord Shiva, who, got stoned a lot of the time. And it makes you think, doesn't it, that actually that there's been conversations about this again for a very, very long time. And I know that, again, in South America, there are specific kind of healing rituals around using kind of, psychedelics, if I'm correct. I don't know.
I think they use ayahuasca.
Ayahuasca, yeah. There's one that I know he actually treated himself with his bipolar with it. And now he treats everybody else in Costa Rica who has those severe, mental health illnesses. Go ahead.
Yeah. And that's, I guess I just wanted to put that out there really in terms of, again, the ancestral wisdom that is within, and we're kind of now being reminded that there are these potential benefits, and again, just do it safely. Again, I'm not an expert in this, so I can't really talk to it. But yeah, really, really fascinating, and I'll be watching closely to see how things kind of emerge in the literature and in clinically as well. Keep us posted, Rubina.
For sure. Yeah. I mean, definitely there's a good documentary called Fantastic Fungi if everyone wants to go watch that.
Oh, good to know.
That one. Yeah.
There we are.
Good to know.
Yeah, will do.
It really is exciting, and it is quite interesting that Tina, as you were saying, that we did use this like in parts of the South Asian culture years and years ago, and as you said, in South America, and it's quite fascinating that it was used ages ago in countries like that, and Europe and America is kind of looking at it more now. Now that there's like lots of stigma attached to it, but they're kind of saying, oh, now that we've researched it, therefore they use it almost. It's quite interesting, but that's probably another topic for another time.
Right. Now it's not,
That's
crazy and backwards and midwife, old wives' tales. Now it's medicine.
Yeah. Okay. We have another question from Ghazal, one of our members. So, when assessing further for migrant trauma, what are some questions you ask when assessing further on someone's migrant trauma or immigration story?
It's a great question.
I guess you would just start to ask those questions, Ghazal. Seriously, you don't need to have a specific protocol in place. One of the things that I've learned over my years of my age is showing now, of doing this is just be curious. Ask what feels right. You will get a feel for how far you can, go with the person sat in front of you, with your client. So it could be just around to tell me how, if you figured out that they are migrants or children of immigrants, just gently asking those questions of, so what was that like? What stories did you hear? Or what did people tell you about what that journey was like? And it's really interesting when we just kind of ask from a position of curiosity, rather than having a set question that it needs to sound like this and we need to get this specific answer. I would say let go of all of that and really just be with the person you're sat in front of, because I think that for we've sort of pointed out, is that this is new stuff. Often many of the people who are coming to sit with us, and we are hugely for me, I feel honored when people share their stories with me, because I know that they've probably never shared half the stuff they're thinking about with anybody else. And when we start to probe and ask questions like that, it can feel, it's a lot to unpack. And you've got to sit with that. You've got to sit with that vulnerability. You've got to sit with all that discomfort. So I would say just go with where your heart and your kind of gut is going. That there's no real set way of doing things. So yeah, just follow the lead. Do the lovely dance that we do within a therapeutic space.
Yeah, I'll add that it can be the case at times that you might not know what that person's history is, because maybe you might not know about a specific war or a specific immigration wave. This workshop today really made me think hard about how being educated in America, being born in America, a lot of my views and understanding of immigration is based on the US. Right. And so I remember even presenting once in Canada, in Toronto, about a Tamil population experiencing trauma. And I remember I had not included refugee status in my survey. And my advisor was, from the same part of India. I'm Indian American. And I remember individuals in the audience in Toronto said, "What about refugee status?" And I was so aware that my population that I was studying in the US, right, the way we talk about it here in the US is different than it might be from another country. So why I share that is to say that if you feel like you don't know about a person's history or their historic trauma or collective trauma, it's okay too to be vulnerable, to like what Tina was saying, to say, I'm not aware. I would love to learn more from you. I will do my own work and I will do my own research, but I'd love if you could tell me from your perspective what your family's history was, or why they came here, or how you understand it. Because it will take that vulnerability on your part for the client to also realize, okay, they didn't not ask me because they don't want to talk about it. They're bringing it up because they don't know, but they still want to know. And they're vulnerable enough to ask me even when they don't know enough about it. So perhaps I can be vulnerable enough to share my part of it. Because I think sometimes we avoid asking things because we don't know about it, or we feel nervous about exploring something we don't know. But then that gives a message to the client, right, that we're not allowed to talk about the trauma, which we don't want to repeat for that client who's probably had that experience outside of the therapy setting.
I just wanted to piggyback off of that. I mean, that was such a good thing. You even said that even also hit me, because I'm also Indian American, born here in America, raised here. And, working with immigrants and refugees, one question I do share when they don't really know is, what's your birth story? Do you know your birth story? How'd you come here? Like, you ask that to your mom, can you ask that to your dad? Because I feel like maybe that's a little bit less like potent in that way for some people. Like, just tell me what my birth story was and how did we come here. And I find that sometimes to break down a lot of that fear and shame around their story, when I'm talking to a lot of immigrants who are coming, who are here in America, or refugees. So just something I just wanted to share. Besides everything else was great too, what everyone, all my other panelists have said too.
Yeah, those all sound like wonderful ways. And it sounds like it's really important just to make them feel comfortable from what I'm hearing you guys say, and kind of just let them know that it's not their responsibility to educate you guys or the therapist, but just to let them give you their personal perspective. And I think many of us that have gone through the American or British education system, I think we all kind of have that element of ignorance. So it's really important just to kind of be aware and keep learning. We have a question from Mita Darji. Have any of you had any experience with emotional freedom technique? I've had some great results with EFT to release generational, sometimes unknown trauma safely and clearing blockages. It's very healing. So have any of you guys had experience with it, or is it new to you guys?
I have not. It sounds incredible. I have not.
Definitely interesting to look into.
Yeah. I think from what I know about EFT, if I'm correct, Mita, you can tell me if I'm wrong. It's fine, because I get things wrong all the time. Is this sort of like tapping and that sort of thing? So I think it's very body based, which I think would really work well. Yeah, tapping. Yeah, would work really well within the South Asian community, because again, there's all this tons of research around where do we hold our traumas, the stuff that you were talking about, Shanta, around the body keeps score, right? We talk about that a lot. And if we can't intellectualize it or vocalize it, it's held in the body. So yes, I think that there probably is a lot of validity around EFT. I think for us as kind of therapists who have come from kind of schools of psychology, we probably haven't been trained in that, because again, it's not a modality that we would have been trained in. Various reasons for that we probably don't even need to go into, but yeah, it's just kind of how training is. But yeah, if it works, oh my gosh, there's so many types of approaches, body-based approaches. I was thinking about yoga,
Mm-hmm.
and I'm saying it wrong because it should be called yog. Yog is again a really powerful tool and a way of being and a philosophy and an education around our bodies and minds that that people are now starting to realize how powerful it can be to healing trauma as well. So I think that especially in the UK, there are many yoga therapists that are training to use yoga for traumatized populations.
Mm-hmm.
So that's just one example, but
Mm-hmm.
there's probably tons of others that I've missed out.
Mm-hmm.
I mean, I've definitely been putting somatic healing practices in my treatment plan, and that's why I became a somatic wellness coach. In that way, kind of changed it a little bit because the trauma is held in our body. And
Mm-hmm.
another book that's also good is It Didn't Start With You. I don't know if you
Mm-hmm.
guys read that one. Yeah. Also a great one. And, for me, I feel like a lot of somatic healing has definitely helped even myself and my clients after they get that awareness, though. Right? Like you have to have that awareness of like, what cycles am I going to be breaking? What's coming up for me? What am I repeating? What are my trauma responses? Because then that's when we can go into our body and then release it and body map, do plant medicine, Reiki, sound healing. I mean, there's brain spotting now, bilateral stimulation. There's so many somatic practices. And I think that's why, because a lot of people are now being aware that trauma lives in our body more than our minds. And that's why I've also put it in my practice and all of my programs. I have one program where it's EMDR and breathwork together. And that's just a whole body, mind, and soul work because it really does push you out of it and get you to like, oh my God, this is what's happening inside of me. This is what I need to do to regulate myself or to give myself peace and love and safety. A lot of these trauma, that we don't feel safe in our bodies. And so these somatic practices help us to become safe in our bodies. And I think that right there changes so much of us because I know when I felt that for the first time, it changed a lot of things for me. And that's what, I think somatic practices are so well versed for, to bring that safety back into your body from so much trauma.
Mm-hmm. And a lot of people will say at times in sessions with me, well, I don't remember anything traumatic happening, or I don't know, something happened, but I can't really recall it, or this makes no sense. I'm making a big deal of nothing. I feel so ridiculous. I'm so privileged. Why do I have these symptoms, right? But we know from attachment theory that some of these memories, some of these feelings can be stored in the body from infancy, right? From a very young age, when we can't access those memories right now. But if our caregivers were angry, scared, fearful, tense, not able to be attuned to us, not able to really be present with us for various reasons, like their own trauma, right? That is stored in our psyche, that is stored in our bodies. And so even if you can't remember something that happened to you, please know that it is still very fair and very valid that your body has stored these memories, and so that body work can still be very powerful for you.
It's amazing how much of our mental stress and trauma is stored in the body. It kind of gives an insight as to why I think lots of South Asian people kind of describe tension headaches or things like that. They describe the bodily symptoms, and what you're all saying, it kind of makes a lot of sense that these kind of practices are really healing and helpful.
Mm-hmm.
One thing I like to share to a lot of South Asian people who are really still against therapy and healing is it's all going to show up as medical issues, diabetes, seizures,
Exactly.
all of that turns into medical issues, chronic illnesses, or even worse.
I was just joking with my husband about how it's really tiring to keep hearing how everything is gas related. I don't know if you've experienced this, but there's so many aunties or someone that will say like, it's just gas, it'll pass. Or, I think I just ate something. I ate too much, or I'm just bloated, or, I don't know if you've experienced this, but there's so many things I'll hear like that about, oh, I just have a headache or my back hurts or,
Yeah.
Yeah.
but more and more as I'm aging, I'm like, is it gas? Are you anxious? Right? Or are you actually depressed? You keep going to lay down. But I'm wondering if you're avoiding the fact that we're in a global trauma and that you can't leave the house right now, or you haven't seen your grandkids in a long time, right? And so, Latino cultures, they call it ataque de nervios, right? For women who've experienced attack of the nerves, so to speak. But I think, maybe correct me if I'm wrong, but I don't recall hearing something like that in a South Asian language. It's just pain, right? But I don't hear anything that really captures how our nerves are attacked by our emotions or by what's happening outside of us.
Yeah, I think the closest thing I can think of is sidcardia, which is like you're eating my head, like you're giving me a headache, right?
Mm-hmm.
And that's just really just shows like how much South Asians are so disconnected from our bodies, right?
Mm-hmm.
And that's how we need to connect to our bodies, like yoga practices, like the meditation, all that stuff, Kundalini, all that stuff comes from us, from our cultures, and we just need to tap into it so that we can actually see and heal from it.
Mm-hmm.
And I think that, when I've thought a little bit about, someone was laughing about the gas issues. I thought that was brilliant. That the reason why we have disconnected is because of survival, right? We've had to survive so much stuff. Our ancestors had to just survive, probably had to deal with famines and war and whatever, migration and all this and that. So they've just literally been trying to keep their head above the water. They weren't able to do the healing and all the kind of, breathing and all the stuff that we're learning about now. To break the pattern of generational trauma, it starts with us.
Mm-hmm.
It has to start with us. I'm a mom of 2 girls, and I know how quickly I can turn into my mom. I can hear my mom's words spouting out when I'm,
Mm-hmm.
why are you not cleaning? Why is this messy? And you think, oh my gosh, I've turned into my mom. And it's small things like that that just make you realize that we can quickly fall into patterns, And these are things that we become conscious of. But what about the ones that we are unconscious of?
Mm-hmm. Mm-hmm.
So I think the sooner we start to do this work, the better. But I'm finding that most people that I've kind of worked with who talk about generational trauma, or we start to address it, are often parents themselves or have become parents themselves. And they talk about this, I don't want to pass it on to my kids, don't want to screw my kids up. And, that's the tough part, that actually we've just got to be good enough. We can't be perfect. There's no such thing as perfect. It's just about, we will always rupturing relationships is normal. It's kind of how we then try and aim to model restoration. They keep coming back, they keep working on. That's the human aspect of showing up.
Mm-hmm.
We're not going to get it perfect. We're not going to get it right. But if we can go back and reflect and regulate ourselves and say, you know what? Oh my gosh, right. That's where I went wrong.
Yeah.
Mm-hmm.
It's like starting your own lineage pretty much as you're breaking these cycles. That's what I tell a lot of also my parents and clients too. Like you already did so much already by doing this work for your children, or before they even have kids, right? They want to clear it out. I just give them so many props because I'm like, you're starting your own lineage right now. It's going to be different. It's going to be uncomfortable because you're starting it, but you're not surviving anymore. You're thriving out of this. And that's like the biggest thing is like, yes, so much have been in survival mode and now we can take it to thriving mode. It's like, thanks for surviving. We got this. Now let us take it to the next level for us and like break through some of these things and really give back to ourselves that we need now. So we're not in survival mode, and I just wanted to share like an example of like a colleague of mine, she's an Indian psychiatrist, and she has a son, and she has been doing her work, and literally it was just the cutest thing I just wanted to mention. And this is where I see the new lineage coming in. She has a son, and she has a calming corner for him. He's like 2 years old, and we're like at a wedding, and he was just like, Mom, I'm upset. And then she just took him to the corner, and she had like one of his stuffed animals, and he just like told her what made him mad. And then like 2 minutes later, he was like back to playing. And so to me, that was just so beautiful, because I'm like, see, look at regulation, like at such a young age. And it's like setting them up for success already, right? To be able to regulate themselves without, projecting it or being aggressive about it. And I just wanted to share that, because it's just like, this is where you see that lineage, you see that beautiful like work coming into play right there, and that healing for our community.
Yeah, I wanted to add to maybe the reasons why too we've shifted away from body work. I think there's so many reasons, right? There's a Eurocentric Western perspective that says it's, backwards or whatever. There's that whole reason. Self-preservation, as you were saying, right, Tina? But I was thinking too about how sometimes the pendulum swings, I think, into extremes. And I don't know about your experiences, but I've noticed some people will say, I'm only following this diet. This will solve my cancer, right? Or like, I'm only going to follow this yoga regimen. This will cure my depression. And so for those who are wanting to do body work, I think that it's so important to do it, but be open to incorporating a more holistic approach, right? And by that, I mean that biopsychosocial approach, right? And if someone tells you at any point to follow one method and that's it, right? Kind of tap into that wise self within you to see if that really feels right. I often think about mood and mental health issues, sort of, if you think about diabetes, right? We wouldn't just say, I'm going to just do this. I'm going to eat donuts, but I'm only going to work out, and then they'll solve my diabetes, right? We need exercise, diet, medication. We need a really three-pronged approach to really nourish ourselves fully. And so I just think about how sometimes I'll hear people in the community say, like, I'm not doing that because I'm doing this. So just being open to sort of what are the types of healing that our community has, that collective healing, medication, psychotherapy, tapping, and really encouraging that so that people have the most nourishment in every possible way.
And I think that's right, isn't it? This age-old saying, one size doesn't fit all, but also that you need to have many tools in your toolbox. We can't just rely on the spanner each time something breaks. We need the hammer, we need all the other bits and pieces. And there's this sort of idea that it's a quick fix. No, it isn't necessarily always a quick fix. It takes work. Do not be afraid of the work. This stuff has been in our systems or in our family lines for years. It's not going to be something you can cure within 2 sessions or 3 sessions or whatever people are trying to promise you. This takes work. It's about growth. It's about you learning about yourself, learning about your history, learning about your future, and paving that way. So again, the quick fix cure, it's not out there. So sorry to burst any bubbles.
There's no magic wand.
Yeah.
I hope no one's too disappointed out there to hear that. I feel like you've all just basically answered Isha's question. What are some ways to systematically begin to heal gas issues? And because I feel like you guys have kind of answered that, I'm just going to go to the next comment from Rani Kaur. She said, trauma in her experience. The questions evolve as the therapy progresses, and to listen to what's unsaid, somatic countertransference can be experienced as a dissociation or disconnection, amnesia. What do you all have to say to that?
I know Rani. Rani's one of our members, I think, if I'm correct. Welcome, Rani. Rani is experienced psychodynamic psychotherapist. If I'm correct, Rani, you can tell me off if I've said that wrong. But yeah, I think this is pretty much echoing what you were saying, Shanta, right? That, you know, it's the unsaid, it's the missing pieces, it's the feeling we get when we really tap into ourselves as an instrument, as therapists. You know, the dissociation aspect of it. Thank you, Rani, for correcting me and making sure I'm doing things right. Yes, I think we do that a lot. There's a lot of amnesia, isn't there? There's a lot of disconnection, and you know, we just choose to push things under the carpet. We, as a community, we are so damn good at that, aren't we?
Mm-hmm.
We'll have this big blow up with one of our family members. Next morning, you know, it's just like normal, you know. We just push it away. There is no sort of how, you know, and this is the bit that the repair is important. We talk about ruptures, but how do we repair? How do we, you know, we can't just push it under the carpet. We have to make things right in a conscious, overt way. And that's the hard bit. That's the sticky, awkward, uncomfortable part of healing process. So, yeah. Thank you, Rani. Thank you for joining.
Yes. I'm just smiling thinking about all the awkward, you know, post blowout, you know, conversations that sometimes we have to spearhead. But when you face that brick wall or that like avoidance or that amnesia, what are you talking about? I never said that. How challenging that can be. That's a sort of thing, right? That can stick into our bodies to feel like, was my reality off then? Was I making that up? Did I make a big deal of things, right? And that narrative, how damaging it can be, and how important then doing the work is to sort of own your voice and own your experience and know that you weren't just making it up or overreacting. You're allowed to have your own memory of that.
And just piggyback off that, I mean, that's where also co-regulating yourself, right? And then also getting that peer support, or that collective support to validate your story and to really be there and say like, no, your story's valid. We hear you, we see you. I think that really helps too when we are dealing with gaslighting, you know, from our families, our culture in that way. Is to lean on to people who really do see you and hear you and acknowledge you for who you are and doesn't make you feel shame for your story.
Yeah. And especially because I'm sure many of these people, you know, they might not have been like validated in that way in the past, like before coming to a therapist. Okay, so our next question is from Brother Hassan. So if any of you have seen this, he wants to know, what do you think about the South Asian psychiatrist who did a live stream about the psychopathic problem of the white mind? Have any of you seen that?
Well, definitely check it out now.
Yeah, I haven't seen that.
Oh, sounds interesting.
There's so much amazing content out there.
Aruna Kilanani. Okay. Well, we'll check that out. Thanks for the heads up. That's really helpful.
Thank you.
I've got another question. It's not currently in the chat box, but how can you guys have all sort of touched on this, but what can intergenerational trauma look like specifically in the South Asian population or amongst various South Asian populations? And would you say that there's any differences to other populations?
Well, one thing I can definitely say with the Punjabi culture, I'm Punjabi Sikh, is alcoholism is really a big one, because back in the day, right, farming through the wars, everything, that's how they regulated themselves with alcohol. And it's gone pretty much down the lineage in a lot of families in Punjab, where it's damaging because it's aggressive. And people don't do anything about it. And to me, that's the one that I mainly have talked about, just because I have witnessed that, experienced that in my own family, and being Punjabi, I just see it a lot, and I've experienced that, going to college and all that kind of stuff. So that's one I can think of right now for sure. I know there's others for different parts of South Asia.
Mm-hmm.
As a quick follow-up question to that, this is just me not reading enough, but I've seen that with the alcoholism, there's more information about Punjabi men. What does the story look like in Punjabi women? Do they have like the same issues with alcoholism, or does it show in like a different way?
It shows in a different way a little bit. Sometimes the women are either having to take care of these men who are alcoholics, or the alcoholism really gets to them, or they also pick it up and it damages them. And they start to either become aggressive, or they get, too deep in it where they can't function. So it definitely does show up in different ways, but I think it shows up in a way, two parts where it's like, oh, I want to catch up to all my male counterparts and also drink as much as them and like be as cool as them. And show them that I'm a Punjabi, I'm real Punjabi or whatever. And the other one is like, oh, I have to take care of them and I can't say anything when they're drinking. I just have to take all this abuse and all this, verbal attack and, behaviors that they're doing and clean it all up and then just put it underneath the rug. So those are the two I have seen in women, Punjabi women. Specifically for me, I don't drink. It doesn't work for my body for these reasons, but it's also because I've also seen that in college where it's like all the Punjabis would be like, you're not a real Punjabi if you can't drink this much. And I'm like, well, how does that caliber into being Punjabi? Because I can't drink. Like that doesn't make sense to me. So that's kind of why I dug with that part, because I was getting shamed all the time for not being able to drink, and I just, that doesn't make any sense to me. Why should I be shamed for something I don't want to do? That I know hurts my body, for that reason. And it really did. I got stomach ulcers from it. So right there, it just, my body was telling me like, this isn't, no. And so I think that is something where as a woman, if drinking is something your go-to, or, you're trying to prove something to somebody, that's something to dig a little bit deeper with your therapist or your coach or, your facilitator in healing for that.
Thank you.
Yeah, no problem.
Shantha, Tina, do you have anything to add?
Is Tina blurry for anybody else?
Yeah, a little bit.
So I can't tell if she's frozen or if she's talking.
Yeah. Frozen and blurry.
Yeah. And I can't hear her. I can't tell if she's. Oh.
Yeah, I think there's a slight lag.
The alcohol one's a really good one, isn't it?
Oh no, she's responding.
Obvious one, isn't it? Sorry, Shantha.
Just messaged her to say the Wi-Fi is acting up a bit.
Oh, Mercury retrograde.
You did say that.
It's something. I really did. Yeah.
You said it yesterday.
It's done to me many times. That's all I know.
Okay, it says that her network connection is now 10 out of 10. So, Tina, are you with us?
I feel like she was saying something, so I don't want to interrupt her. So I want to wait for her to come back. Oh, she's back?
I think, yeah, she's slowly coming back. It's kind of the epitome of the 2021, 2020 zero. She just said to carry on. So yeah, while she's coming back with us, Shantha, just please share what you were going to say.
Sure. I was going to say that I think to Rubina's point, I think.
Can you hear me?
Kind of.
Yeah.
Yeah, I think there's just a slight lag. Yeah, Shanta, if you carry on.
Sure. I was going to say to Rubina's point, I think. Oh, is she back?
Coming in and out.
In and out.
Yes, in and out.
But I was going to say that I think that each community can manifest trauma in different ways, right? Based on how that their family enacts gender, how they perform masculinity and femininity, how maybe their religious background sanctions it or does not sanction it, right? So I think that what's hard is that each family, even if I were to say one broad statement about one group, right, it's going to be so different based on family and how their family has been taught to cope with things, right? But I think that across the board, what I've noticed is that trauma symptoms look similar across communities, right? It's nightmares, mood disorders, perhaps hallucinations, irritability. It impacts parenting, difficulty with regulating mood. I think all of these, alcoholism, right? I think trauma manifests very similarly across the board when there's trauma at play, right? That's what we know. But I think how it manifests is based on, again, like all these other factors. Also, in addition to the ones I mentioned before, it's also the nature of the migration story, right? Did somebody come here with a lot of support? Did someone come here with a whole family to welcome them? Did someone come with financial means, right? That's a very different story than someone who came, without immigration papers or with no community or having to ignore their training in their country of origin and have to work another type of job, a blue collar job, right? Because their degree was not honored here and had to build themselves up and deal with racism in totally different ways. So I think we have to really take a close look at the intersection, right, of what people bring into the mix, and then how that, how trauma then manifests based on those intersectional identities.
And I just want to add also personality disorders or personality disorder traits also come in.
Mm-hmm.
That's so overlooked in our community of personality disorders, and there's so much untreated personality disorders alone in the South Asian community.
Right. People will say, oh, they're just a strict person, or, oh, they're just that cranky uncle, or like, oh, they're just, she's being such a typical auntie or something. Like sometimes I think
how they are, right?
Yeah. And that can really shove under the rug when someone is actually outside of the spectrum of just being a strict auntie or like a cranky uncle. Like there's a spectrum that I think we can say like, okay, falls in that range, but then we have to pay attention to the ones that are struggling and cutting people off or using narcissism in ways, right, that are really not in that range of adaptive behavior.
Yeah. And a lot of the times, we do kind of just give that a pass. Like you guys just said, we'll just kind of write them off as someone either stuck in that generation or someone that's never going to change almost, or we should just kind of let them continue that behavior.
Mm-hmm. Yeah.
And we should probably start holding more people accountable in that way.
Mm-hmm. And sometimes that might be true, but when is it affecting that person's work, job functioning, career functioning, family functioning, social functioning? When are they being cut off? When are they creating marital issues, right? If we look at how that spills over into other aspects of their life, then we need to consider this is more than just something to ignore, right?
Yeah. Exactly.
And it might be hard to realize some people might have, undiagnosed personality disorders, but but that it can also help you understand, okay, how do I need to behave? What are my boundaries in dealing with these types of family members or people in our communities because they have this? Doesn't mean you need to go and, deal with it or anything like that. It just gives you more of that, okay, what's my safety level? What's my boundaries here in this? How do I regulate myself when I'm around this person? Because they can do that.
Mm-hmm.
So I think that's also also another way to also dig too. Piggybacking on what Shante.
Mm-hmm.
Yeah.
Okay. I wonder if we've got Tina back yet, or if she's still.
Mm-hmm.
I think she's frozen.
Ah. Okay. Well, I guess we'll just continue to carry on without her.
Yeah.
Ronnie's commented again. So she's saying the ongoing trauma of white racism can go unseen. Can be very re-traumatizing for South Asian and Black clients who are in therapy with some white therapists who may not be race aware. What are your thoughts?
Mm-hmm.
That's a good one, especially for both of us in America. Oh man,
It's a rich topic.
Go ahead, girl.
It is a topic that we keep returning to over and over, and has become, I think, abundantly more clear as we've had specific historic things happen in this past year or two, right? Yeah. So there's certainly, that's why I'm so appreciative of the white therapists that are doing their work and are humbling themselves to recognize the work they need to do, and appreciative spaces like this where therapists of color are being recognized and being showcased so that people can access therapists of color more easily.
For me, like definitely, I'm in San Diego. It's really a lot of white people here. I'm literally the two South Asian therapists here. So I have a lot of BIPOC people coming to me because of these reasons, because they do get re-triggered, and because they get tired of explaining to the white therapist what their culture is, right? Or what we have to deal with. And I do have on my Instagram, Mind Peace Wellness, some questions for you to ask your therapist who are aware of racial and justice issues that are going on. So if you guys want to go ahead and you can go ahead and check that, I have that, because I do recommend anyone to go and question your white therapist. Question them. How much have they known? Or they don't have to be white. They could be a totally different person, but how much do they know? What have they also learned about this culture? What do they know? Because this is very important. You are in there being vulnerable and you have to feel safe. So I think, that's where a lot of clients and people are finding people like us, who are the BIPOC therapists, so they can get that safety and that acknowledgement and being seen. But if you can't, I would question them. How much do they know about this part, and what are their thoughts of this? I think that's a great way to get a conversation going with some of those white therapists. And the ones who do the work, they'll show up and they will tell you how much they're working on. And the ones who don't, then you got your answer and on to the next one you go.
That's great. And I just wanted to highlight this comment from Brother Hassan. He doesn't want his white therapist to get upset.
Ooh, so why are you protecting her? Why are you protecting your white therapist?
Yeah, I would dig into sort of what would happen if they got upset, and what is that reminding you of, and what is that paralleling, and what does anger mean to you in the room if you have to be the one to initiate something uncomfortable, right?
That was a joke.
It was a joke.
Oh, I know. Yeah. I mean, I figured he was also quoting somebody who said that.
Yeah.
And this is where white fragility comes in. This is the time where we do need to go in.
Yeah, because even though this was a joke, many people will probably feel this on like a subconscious level, at least, isn't it?
Oh yeah. Like I have a lot of, white people, colleagues in the wellness center who are doing the work, and they show up for people of color. They really do. And they know
That's
how.
really good to hear.
Yeah.
Mhm.
And oh yeah, as it is 7:30, yeah, we are due to end this discussion here. We had one last question. If either of you can answer it very quickly. What are you seeing with the sandwich generation or those living with in-laws in multi-generations?
Oh, this is getting so hard. I'm seeing it more and more these days, perhaps because of my age or perhaps of who I'm attracting, but so much stress, especially due to COVID with the sandwich generation, right? Caring for both generations, their young ones and their families. Get support is what I would say, right? Please get support and know that you're not alone. And creating that community that Tina was talking about, I think is really important here because this is something that lots are struggling with, and doing it alone is not the way to go because it will be exhausting.
I agree with Shanti right there. It's get the community support that you need and build your own community or your soul family in that way so that you are feeling seen and heard, because being in the home with multiple generation, it's re-triggering. It really is.
Mhm.
Also where inner child healing comes in too. Like I would really recommend inner child healing, reparenting that. That really would help too.
Yeah, absolutely.
Thank you.
Oh.
And that is our final question. Thank you both. And of course, thanks to Tina, who's no longer here because of Wi-Fi reasons. Thank you guys all for joining us, answering all of our questions, educating us so much on this topic.
Thank you.
Thank you. Thanks for having us.
Thank you for the space, and please do Tina as well.
Yeah, thanks, Tina.
Take care, everyone.
And for all of you watching that sent in your questions, thank you as well, because you guys make this panel discussion as much as our panelists as well. And with that, we'll see you next time, and this talk will be uploaded onto YouTube in like the next minute. So if anyone wants to watch it on demand later, you can. If any of you guys watching are therapists, South Asian therapists, you're welcome to join our network or just take a look at our site for other events coming up. We do peer supervision sessions as well if you want to be part of that collective space. And yeah, thank you, and good morning, good evening, good night.
Thank you. Take care. Bye, everyone.
Bye, guys.
Bye.